All right. Good evening, everyone. I'm happy to welcome us this evening to this webinar where we'll be discussing about prevention of drugs and substance abuse. And we'll be talking about Qatar laws against drugs trafficking. So it's a pleasure to welcome all of you on behalf of the executives of NIDO Qatar. My name is Johnson Wala, and I happens to be the PRO of NIDO Qatar. So without wasting much time, I will like to welcome Mr. Stephen, who will be leading the first phase of the discussion. After him, I will take up to discuss about the Qatar laws against drugs trafficking. So you are all welcome, and there will be time for question and answer, and there will be time for also contributions and feedback. So do take your pen and paper and contribute at the right time. So Stephen, over to you.
Thank you very much for giving me this opportunity to have my little presentation to our community here in Doha, Qatar, and as a Nigerian, and also to some other professionals who are also joining in line with this webinar section. As we all know, from the topic of today, or discussion, or webinar rather, has to do with drugs and substances abuse prevention. I would just like to start by letting us understand that we cannot discuss or talk about prevention of certain things without we having a kind of rudimental knowledge or basic knowledge or understanding about what this thing is talking about. So when we talk about drugs and substances, in most cases, these words are used interchangeably, depending on the field in which this discussion is coming from. Okay, so probably in the public health area, they might just be emphasizing on drugs. If we are looking at an enforcement agency aspect, they might want to make a distinction between drugs and substances. Some school of thought, depend on the school of thought. So, but for me, when you look at it, those words are used interchangeably. So most times it's just better for us to use the word drugs and substances abuse. So in order for us to have an alignment between, because when we say drugs, people just think only cocaine, so in which way they are together. So going forward, drug and substances abuse is a complex and multifaceted public health concern that affects individuals, family, community worldwide. Okay, so understanding the root cause and the consequence of these substances are crucial in order for us to devise a strategy or a means, in order to provide prevention strategy rather in combating such menace within the public health space. So going further, I will just want to give us a brief introduction, in order to understand the overview of what we are talking about. Like when you look at the drug or substances abuse, refer to an excessive use in the amount or by method that are harmful to individual or others. Okay, the activity might be affecting the individual who is taking it, but at the same time, it might be affecting other people within the environment. So, and it's a form of substance-related disorder and can lead to criminal penalty, physical, social, and psychological harm. Drugs or substances abuse is a complex and multifaceted, like I've said earlier, public health concern that affect individual, family worldwide. Like I also said, understanding the root cause is very, very crucial for us to develop strategies depending on wherever we are or which institution we are working for, to develop this strategy in order to be able to control or prevent, as the case may be. Now, my presentation today will be focusing on these drugs and substances abuse into two category, or I would like to say majorly they exist in two forms of category. We have the anabolic steroid and we have the psychotropic opioids. Okay, so when you look at it in this perspective, we know, well, let's look at the sports in terms of sport or an athlete. We know what it means in the sports arena or in the field of sports, how offensive it is when it comes to doping. There's what we call doping. You know, when you take drugs before you go into the field of play, or you go into the track and all that to perform. We know how a lot of people have been banned from sporting activity as a result of this anabolic steroid. You know, basically, with information that I have with me is that this anabolic steroid, they are also classified as drugs or substances, you know, which are used by athletes for muscle development and also to increase strength. We have a couple of them. They call them nandrolone. We have oxandrolone, oxametholone, and so on and so forth. Testosterone is part of it. Danazole is part of it. So there are so many. The lists are endless. But for the purpose of this webinar, I just try to make sure very few, because for those who are involved in sporting activity, those who are involved in lifting and all that, they are, most of them, they take in these drugs or substances, like the information I provided in the slide talks about. It helps them to develop, you know, their muscles and also increase strength in the field of play. We could see that even for the just concluded Nations Cup qualifier, we had that our own striker Victor Osimhen was taken for several tests because of the kind of energy he possessed. So most of the time when you're exposed to such kind of drugs, it gives you this extra energy. But naturally, some people might have this energy as natural, you know, embedded in them. So basically, in terms of sport, they don't take it very lightly. When the anti-doping units investigate and find out that an individual is having such within his bloodstream, is a very serious offense that can be given to such an athlete banned for several years, you know. So also, when we look at the psychotropic opioids, this is where we might be focusing most of our concern, because it now deals with the general public, you know, where people are exposed to substances, you know, that affect their mental health, you know. So, and these psychotropic opioids are also substances, you know, which are, we can also find within the pharmaceutical setting, okay? We should not get it twisted, because some of these drugs are meant for some certain purpose, even within the medical or public health setting. But it is how we used it, you know, that now determine if it is being abused or not. Okay, so that is why the topic talk about how people have been, how people used it abusively. You know, so it's very, very important. Even the so-called normal paracetamol, normal drugs we just take as medication, when you take it in an abusive form, it has a repercussion or a ripple effect on our body physiology. So when we talk about psychotropic opioids, these are substances that affect the user mental health and are used to produce changes in mood, feelings, perception. E.g., we talk about opium and its derivatives, such as heroin, hallucinogen, we have the barbiturates, we have the cocaine, which most of us, we know how harmful or it could be and how offensive it is in any part of the world for somebody to possess such substances. Most of us, we are familiar with tramadol, especially those of us from Nigeria. We might have heard about this tramadol of a thing. We have the amphetamines, we have the tranquilizers, we have several forms of cannabis and alcohol. Even the so-called alcohol we take are all part of the psychotropic opioids, which are substances that are being regulated by most country or jurisdiction, you know, in order to prevent people misusing them or restrict them completely from using it. So now, understanding the causes and risk factor, okay, in some cases, it can come from a genetic and mental health perspective, because certain genetic predisposition and underlying mental health condition can increase the risk of substances abuse. So it is very important that early identification and treatments are very key and fundamental, because we might have heard about maybe like an issue of maybe people like this kleptomania, people who steal. These are genetic in nature. Okay, sometimes you see some people steal are hereditary. You know, in our elementary biology, where we don't go deep into genetics, but when you go into university and you decide to do some courses that involve a deeper advanced genetics, then you begin to understand some certain things that when you acquire them along the line, and they have some effects, you know, on the genetic constituent of the human system, thereby giving a kind of predisposition to hereditary as a factor. So in most cases, when you see people who are exposed to substances abuse, they have some traces as being a genetic factor or predisposition to such kind of activity. So also, we have the environmental influence. Okay, so this environmental influence, we'll talk about factors like peer influence, family dynamics, poor parenting, availability and exposure, societal approval of such kind of drug or substances. Because the truth is that we know most of the cases that are recorded could be as a result of peer influence. Your peer can influence you to go into it. Family dynamics sometimes, you know, depending on the nature of the family, the background you're coming from. And also, if someone has be exposed to a poor parenting where there's no proper guidance, no proper nurturing and all that. So such kind of child might be loosed, you know, at the early stage to be exposed due to the influence of peer and get engaged in such kind of abuse. And also availability exposure is also important, because in a country or in a nation where such kind of drugs are well regulated, you don't find them easily in the society. So you discover that it's very difficult for people to get exposed to such kind of drug or substances. But in a situation whereby it is readily available everywhere, in some community, in some country that is so porous, there you see every Dick and Harry. They have it in abundance with them. So definitely this is also part of the environmental factor. Societal approval, like I've also said, when it is generally acceptable in some particular jurisdiction, then why you will definitely have such a group of individuals who are exposed to such substances and drugs. And also we have the socioeconomic status. Okay, so poverty, lack of access to resources, limited educational and developmental opportunity are also risk factor that can lead to substances abuse. You know, when you find yourself in a socioeconomic condition or environment whereby there is poverty, you don't have access to education, you don't have access to good resources and all that, you know, employment opportunity. We know some part of the world will come from, we know all this as a play, this socioeconomic status as a play, you know, especially in most of the developing country or underdeveloped country, we find out that these are the area where you can record a significant amount of people who are exposed in such kind of drug and substances abuse. So basically, we're going to look at the impact of drug and substances abuse. Now, because why I'm running through this before the prevention is for us to understand. We cannot talk about prevention without understanding what is drug and substances abuse. We cannot talk about what are the factors that makes people get involved. And we cannot discuss about prevention without also understanding what the impact is, you know, to an individual and to the society. So when we talk about the impact of drug and substances abuse, we look at it from the physical health consequence. We all know that substances abuse can lead to serious medical issues such as vital organ damage. And when we talk about the vital organ damage, we're talking about the liver, the kidney, the heart, and the lungs, and addiction and overdose. You know, so like I've said, some of these drugs or substances are of medical importance. But when you get addicted to it, when you abuse it, it becomes a problem. to an individual health. Okay, so secondly, we have the mental health challenge, because drug and alcohol abuse can exacerbate or contribute to a mental health disorder such as depression, anxiety, and psychosis. Now, when we talk about depression, anxiety, and this thing, you see, there's an interrelationship between even somebody who has undergone stress due to depression and result to depression and anxiety. This can in turn predispose this individual to make use of drug and substance, or to abuse it at the end of the day. So even when you expose yourself to the use of drug and substances, it can also lead to depression, anxiety, and so on. But it is not only this exposure to drug and substances that can lead people to depression. Even some work-related issue can lead to depression. So even at the depression level, that can also lead you into this abuse of drug and substances. So when we look at the social and economic impact, we all know that substances abuse can disrupt and has disrupted a lot of relationships, has also disrupted a lot of people's plans in terms of education, also in terms of employment, leading to financial instability, social isolation, and also legal problem. Because sometimes in society, when they find out that you are involved in drugs and all those things, people go away from you. People don't want to associate with you. So at that point, you discover that you just have to become an isolated individual. You too, you have to like isolate yourself because you don't want to associate yourself with people. And that might result in you losing your job. That might result to people dropping out from schools. That can also affect our individual relationship, either in our marriage or within our family. And also this could lead to a legal problem, as we all know that in some jurisdiction, because we know in most countries, when you talk of cocaine, for example, it's a very serious offense. So when you are caught, the kind of punishment that in some countries, once you are caught with it, in fact, it's a death sentence. You understand? We all understand better about all these things. So we will not want to start digging deep into all this area because our emphasis is just more of the prevention. So we will not, time will not permit us to go deep into some areas in terms of the impact and abuse. So we have what we call intergenerational consequence. You know, children of parents who struggle with substances abuse are at risk of developing their own issues that has to do with drug and substances abuse, like I've talked about. Because when we have parents who are exposed to such kind of lifestyle and all that, you know, I will just give an example for some parents who smoke, some parents who drink. I mean, when your kids, they are growing up, you find them smoking, drinking, how do you want to tell them, guy, don't do this? What you are doing is wrong. They won't want to do that. So the same thing applicable if any parents are involved in such kind of drug and substances that are not that are well regulated outside, and there's likely tendency and chances that these children will also be exposed to such stuff. So now we have to look at now our area of focus will now come into the effective preventive strategy. You know, that is where who comes in as an individual, as a professional, to see how we can devise some strategic means in order to prevent such kind of abuse within the society, within the space we find ourselves. And, you know, it is very pertinent and important that community engagement is very, very vital, you know, because in this aspect, we have to involve local organization, we have to involve schools, community leaders in the prevention efforts, you know, because this can create a kind of comprehensive and collaborative approach. Because the truth is that the fight against abusive use of drugs and substances is not an individual, is not an institution approach only. It has to be a kind of collaborative effort. It needs to be a kind of a comprehensive strategic approach, because everybody has to come together. You know, from the level of school is very, very important and fundamental, because at that level we are dealing with the issues from the grassroots. We are dealing because in some school or in some country, this kind of prevention strategy are introduced in some schools curriculum, you know, to get the individuals or children who are young into getting them exposed, letting them understand the causes, letting them understand the impact which such exposure could cause, to them or to their family and even to the society at large. So letting them understand at that level is very, very important. The education at the school cannot do it alone. Organization, NGOs, the government agency that are saddled with the responsibility to regulate. That is why you see in some country, in some jurisdiction, there's always a kind of campaign. There's a lot of sensitization, awareness to inform the public, about all these things. So, like I said, regarding school, that is where the early education and awareness comes in. Like I've said, it is very vital and important that we catch them young by introducing the effect, the impact, letting those children know the effect at the early stage. I think this will be able to create a lot of awareness and prevent people, especially the young chaps, from being influenced by peers, and we'll talk about the policy and regulation. This is where the government, the regulators will come in. This is very, very important because the first point of people who are supposed to make things work are the government agency, the government, the body. They need to design policy, they need to implement a lot of regulation, that will help in terms of restricting the people, the public of having access to these addictive substances. Because if there is no policy, it's not about just even having a policy. It should be implemented. Having policy is one thing. Another thing is implementing it by enforcement. That is when it will work. Because policy is just a written document. When it becomes valid or value, it's not about just signing a policy. It's when you begin to implement, effective implementation. There must be action, So with that, we'll see that people refrain from such, not government just saying without implementing. So it's very, very important that policy should be developed, policy should be implemented, enforcement agency should help in the implementation. So with that, we can have a better society, and a lesser negative impact to the society. And also another prevention strategy is that we look at family support. There should be a kind of strengthening family bond, by providing resources for families that are affected by substances abuse. And also this can aid prevention and recovery, because when we talk about prevention, we don't just only look at people who are exposed to get affected by it, but we also look at people who are already engaged in such kind of activity to see how we can rehabilitate such people from such problem. So going forward, there's what we call early intervention and education strategy also. In this process, we have to look at screening and assessment, because early identification of substances use through comprehensive screening and assessment is very, very vital for timely intervention. Because if we are able to identify at the early stage and also carry out a kind of screening and assessment at the early stage, it is very easy, to pull such an individual from such kind of act or activity. But if it's become so prolonged, it takes a longer time also, to rehabilitate such kind of individual. But for early intervention, this person might not even need to go to be rehabilitated. You can just give some kind of form of counseling and kind of withdrawal mechanism to push such kind of individual out of such exposure. So we also have a kind of evidence-based treatment. In this kind of intervention is a form of early intervention also. We have to provide a kind of access to a range of evidence-based treatment options, including counseling, like I've said earlier, medication-assisted therapy. We also have what we call support group. This can also help individuals to overcome this addiction within them. And also we have a comprehensive education. Like I've mentioned earlier, we cannot rule out. Education is very, very key. Educating individuals and family community about the danger and substances abuse, as well as an available resources to support them, can empower them to seek help and make an informed decision when they come across such situation. We also talk about another kind of strategic move is building a supportive community. It is very, very important because at the end of the day, when it happens within a community. Okay, like I've said, there are some society that these things are that are readily available. So you discover, most of us, we are Nigerians, we know there's what we call colos or whatever. So many things. Hey, people have been exposed to so many substances. Because when you look at this colos, it's even is a kind of derivative of this marijuana or something like that. So, but a synthetic form. And the unfortunate part is that once they are synthesized that are not natural, the compound tends to become more active than even in its natural form when you get it from the herbs itself. Okay, so, and when individual takes it, you see, these are practical, these are things we see online, we see how people behave. You know, because this discussion will not want me, it will not allow me to be able to bring out pictures, evidence to see the effect of an individual, because here we are talking about prevention. You know, if we are talking about a topic in a broader form, the time will not allow us to see how a lot of people in the United States, even in a developed country where such substances are abused, you see how those people looks like when they engage themselves after 5 years, after 10 years, you know, and see how they misbehave within the public space. So that just by the way, like I've said, being in a supportive community is very important because we need to develop a kind of support group that is a peer-led support group that can provide a safe and nurturing environment for individuals in recovering and their loved ones. Okay, community outreach also is very, very important. These are being done in most African countries, in most parts of the world, where you engage with local organizations, faith-based institutions like the church, the mosques, and all that, and also community leaders. Okay, to raise awareness and connect individuals with available resources that can foster a kind of supportive network in order to prevent people from being engaged into such substance use and abuse. Also, advocacy and partnership. You know, it is very, very important. Advocacy is a form of education. We need to advocate for series of policy. We need to advocate for changes. We need to advocate for collaboration, you know, especially with the healthcare providers, law enforcement agency, and other stakeholders that can help us create a kind of comprehensive community-based approach in prevention and recovery for those who are already been exposed to such abuse. And also educational initiatives, you know, implementing educational program in schools, which I've mentioned earlier, workplaces, because it's not only in schools, this is a broader, the discussion is in a broader concept, in the sense that we are not focusing, maybe talking as an health and safety practitioner, we are talking in a broader level, you know, in a level whereby people who are in health and safety are here, people who are in healthcare are here, people who are in education are here. We are talking about a public concern. We are talking about a public safety, you know, when we talk of this. So definitely all stakeholders must be involved. So it encompasses schools, it encompasses our community setting, it encompasses where we work. So we must collectively put hands together to ensure that this knowledge are being communicated, are being advocated, so that people can live and make an healthy choice. Now, another point again is developing an healthy coping mechanism. And this healthy coping mechanism is very, very vital, because sometimes we might need some kind of professional help. So this is what we will get from professional consultants, okay? In this aspect, we, you know, to prevent or to recover people who are exposed, you know, and most especially for the prevention, because sometimes it's idleness. You know, people who are engaged, because I keep telling somebody, if you are busy, in fact, if you are over busy, you will not even have time to even look at your wife's face, for those who are married. Okay, so that's just it. So, but we need to engage ourselves in a lot of things that will distract us, you know, from being influenced by peer, by being influenced by the situation, and we'll find ourselves. We know it's not easy, but we need to get ourselves adapted to this coping mechanism to be able to drive us away from such kind of activity. One of the most important one is mindfulness and meditation. Meditation is very, very important, because when you engage yourself in this kind of activity or practices, it can help individuals to manage stress, anxiety, okay, which could predispose an individual to drug and substances use and abuse. Okay, so like I've said, it's not about when you engage in such an activity. From this stress, anxiety, we get it from the workplace. We get it from relationship. We get it from so many places. This can expose a lot of us into drug and substances abuse because there's this belief that, oh, when taking this thing, it will calm my nerves, it will calm my nerves. Individual body, biochemistry, physiology works in as much as we have a general way the mechanism works, but individual has different capacity. What somebody can take without having an effect, another man can take it, the next thing you find is in a psychiatric hospital. So we need to be mindful of this. And also counseling and therapy is very, very important. Seeking professional counseling and therapy can equip individual with tools and strategy to develop healthy coping mechanism and address underlying issues. And also, we also have a physical activity and hobbies. People who engage in a lot of physical activity, participate in sports, different kind of thing. This will make you to have a fulfillment. You will not be this distracted and get engaged into being exposed to influence that can make you get exposed to substances abuse. Yeah, I know we have limited time to spend on this discussion because Mr. Johnson will be talking about probably the legal implication based on the jurisdiction we find ourselves. So in conclusion and a call to action, I would just like to inform every individual that comprehensive approach is very, very important and is a very key important point because addressing drugs and substances abuse require a multifaceted approach that combines preventive, early intervention, treatment, and community support, like I mentioned earlier. And we also talk about the individual and collective responsibility is very, very vital. Individual, family, community, policymakers all have a role to play in tackling these critical public health issues. Okay, and also empowerment and hope with the right resources, which is very, very vital and important. Support, commitment, individual can overcome addiction, reclaim their lives, and leading to healthier and resilient society. I'll end by saying thank you very much for giving me this opportunity to discuss this vital and important topic to our community and our professional colleague. Thank you very much.
All right. Thank you very much, Mr. Stephen, for that wonderful discussion on prevention of substance abuse. See, like he has said, is a call for action for everyone. It's not an individual issue, and it's not what somebody can do all alone. So for some of us, or most of us here, we might not be abusing the substances, but we have a role to play to discourage people, the younger ones. Like social media is everywhere. People are learning a lot of things from the social media, but we have a role to play to ensure that we send the right message and let people know what is right and what is wrong. Some people go into it unknowingly, not knowing what the implications are. But discussions like this tends to increase our knowledge. And like Mr. Stephen has enumerated, there are so many factors that could lead somebody into going into substance abuse. So if we have this knowledge, we can be able to pass it across in our various workplaces or in our churches or in our places of worship or even at our homes. So that is one of the major aims for this discussion today. Okay, going forward, like we communicated, we'll be talking about the laws, Qatar laws against drugs and substance trafficking. And these laws, I'm sure that it's similar to most countries. So don't say because you are not a resident in Qatar, then you are not going to pay attention. So whether you are in Qatar at the moment or not. And I'm sure most of us are in Qatar. So let's pay attention to this very vital information. There was a webinar organized by the communication department of MOI on the, I think that was on 28th of March. So that webinar was aimed at educating the entire community in Qatar about the risk associated with moving around with some substances, that even drugs, or coming into Qatar or leaving Qatar with drugs that can put you into problems. So that was the aim of that webinar. And after the webinar, the minister charged all the community members present to carry this communication to our various communities. And that is one of the reasons why we are having this webinar today. So I was opportune to that webinar, so I will try to communicate some of the informations I grabbed from that webinar. So the first thing is carrying items belonging to others makes them automatically your own. You are responsible for whatever you carry for people. If you are moving from Qatar to Nigeria, or from Nigeria to Qatar, or from Qatar to any part of the world, so whatever item that you checked in your luggage belongs to you. There will be no excuse that somebody gave you the items to give to someone or to take to somewhere else. So that should be well known to us or to you, that whatever items in your luggage belongs to you. There will be no excuse that it was given to you by someone else. So either is narcotics, medicinal drugs. So any item that you are taking belongs to you. So you are not allowed to take medications or take substances for someone else. Okay. So another important one is the medicinal drugs that you take. They require prescriptions. If you are carrying medicinal drugs for yourself, you are required to have a prescription from a certified medical doctor and a hospital. And the instruction is that it should not, that certificate or that prescribed certificate should not be more than 1 week from the day of your travel. You should not bring medications or medicines for people, even if it's prescribed by a doctor. As far as it doesn't belong to you, you are not supposed to take it for someone else. Okay, then let's talk about, so for sick travelers carrying medications or drugs or narcotics or psychotropic substances, that they should be authorized. So if you are sick in Qatar and you are moving away with your medications given to you from the hospital, you should carry your prescriptions, your certificates, and all the authorities that you need before you proceed to the airport. So you should have a attested medical report issued by the hospital that treated the patient, and the date should not exceed a period of 6 months, and it must contain all the information, all the personal details, the diagnosis, the treatment plan, and the medical prescription should all be contained in that medical certificate that you are taking along with you. And that you should use these medicines for only personal use, that it should not be transferred to someone else. Now, there is what they call risk of connivance. So the Honorable Minister said that even though you did not commit any crime or you were not part of that substance abuse, but if there is an arrest and you were found in that vicinity or in the location, that you will be at the risk of hiding a crime. That what you are supposed to do is to report whatever information or whatever activity that you have observed involving misuse of drugs or substances in your location. If you observe such thing and you didn't report to the authorities, if there is an arrest, you will be arrested not as a user or as an abuser, but you are hiding crime. So you will be arrested as a connivance. So in that situation, you are going to either pay a fine of 10,000 reals or you go to prison for 1 year. Then, in such situation, what you are supposed to do is, whenever you observe such thing happening within your vicinity, you need to report to the authority so that you will not be in this mess together with the people. Now, for drug abuse, there is difference between drug abuse and drug trafficking. So, explain that drug abuse in the law, in Article 37 of the Substance Abuse Law of Qatar. So it stipulates that people who abuse the drugs are different from people who are trafficking the drugs. So for drug abusers, they have a penalty of 3 years imprisonment or a fine of 20,000 Qatar riyals. Now, in this, what defines a drug abuser is someone who was caught with a low quantity and he's not selling it, or he's not trafficking it from one place to the other, but he was caught consuming it, and a low quantity was found in his possession. So such person will be charged as a drug abuser in Qatar. But in a situation whereby you are caught as a drug trafficker, then you have a fine of 500,000 Qatar riyals or a life imprisonment or death sentence. So for a drug trafficker is someone who sells and who was found in a custody of a large quantity of these prohibited substances. And according to Article 34 of Qatar Drug Law Enforcement Law, then the person will be either having life imprisonment or death sentence or a fine of 500,000 Qatar riyals. And these substances was found in his possession with the intention of trafficking, with the intention of selling, and with the quantity is higher than what an individual can consume. So such person will be charged as a drug trafficker. So from our discussion today, I think Mr. Stephen has talked about signs of addiction. So in that connival punishment, they were saying that if you observe people that shows some signs of addictions, that it's a red flag that you should know that something is happening in that environment. For example, if your roommate or somebody you work with are showing these signs of addictions in outward appearance, he appears yellowish in face and is rapidly decreasing in weight. He's having a personality disorder or lack of attention to his dress. He dresses haphazardly, and you'll find some strange tools in his possessions. Strange tools like a syringe, like needles. So such are signs of addictions. And if such person is your roommate and you are seeing these signs, so it's an opportunity for you to do further investigation to find out if the person is abusing substances. And in that situation, you are supposed to either report him to the law enforcement agencies or encourage him to go for seek for medical help. Then, and if you do not take any action, and eventually he's caught, and you are in the vicinity at that time, you will be charged for connivance. So these are some of the important tips that we should always bear in mind. First is, do not carry any materials of others without making sure that you are aware of their content, because you are bearing full responsibility of any material you are carrying for somebody, no matter if you are aware of the contents or not. Avoid bringing in suspicious substances or drugs, because some narcotic substances and medicines may be allowed to use in your country, but they are not allowed to be used in Qatar. So it's advisable that you do not bring in any suspicious substance. First of all, you have to investigate, ask questions if this is allowed in Qatar or not before you bring in any of those suspicious substances. Then stay away from suspicious places and bad companions. So people that could put you in trouble, or people that you suspect are abusing these substances, stay away from them, because you could be arrested together with them. Do not hesitate to report any crime or security. Security is a shared responsibility that everyone bears. Then the next one says, drug abuse destroys your life and drops you into the abyss. So drug abuse is not something that anyone indirectly or directly should encourage. So we should all put our efforts together to ensure that we'll reduce it to the barest minimum. Okay, so that is the end of my presentation, and we'll give time for a few questions and comments before we call it a day. Okay, Mr. Stephen.
Yeah. Going forward, I would like to reemphasize on one or two things which you have said, because when I believe this is a Nigerian community, okay, and also for other visitors who are also part of this session with us, but I really want to emphasize within our community that it is very, very important, because you raised some one or 2 points, which is very, very important, because I will keep re-emphasizing it, because, when you talk to me about this topic, I told you, we should not just focus on the word drugs. We should also use the word substances. Like when we started the session, I tried to make, they are the same thing. Either you use the word drugs or you use the word substances. But some school of thought intend to use them together, because most people, there's always this misconception. People cannot really differentiate. When you say drugs and substances, they see it as two different things entirely. Because the truth is that, and when you mention the word drugs, people just only think of cocaine. People think of marijuana. Okay, people don't look at it, looking at even at the medication level, because this is very easy, because a lot of people just take some drugs out of the country, coming to another country. It is very important, because I will cite a scenario of an incident that happened in Nigeria with a lady, which his father was, I don't think, maybe his father is a journalist or something like that. They were going for Hajj, I've forgotten the year. Most of us are aware of it. Even she wasn't carrying an item. But we should, as an individual, we should be sensitive, especially when we are traveling, especially at the airport. Okay? Now, a particular luggage was packaged, with prohibited substances going to Saudi Arabia. The bag was tagged using that information. In fact, it was the intervention of the past government of Nigeria, because probably the father was a little bit influential. He could penetrate. If not, this lady was in jail in Saudi Arabia. waiting to be sentenced. But it was just by the grace of God and the intervention of the government of Nigeria that was able to make her escape such punishment. In fact, even with that even made her, she even joined the Nigerian Immigration Service today, as we speak. She's a commissioned officer within the Nigerian Immigration Service, because that taught her a lesson and see how she can contribute her own individual efforts to ensure that people are being misusing these substances and all that. So it is very, very important that we understand what we take. Sometimes people will just tell you, oh, you have a luggage coming to Nigeria, you can help me bring some things and things like that. My dear brothers and sisters, it is very, very important. It is very, very vital that whatever you want to help somebody to bring into any country that you are, this is not only Qatar. It is very, very important you understand what the item is all about. Any item that will put you into trouble, I will not advise you, because at the end of the day, the community will start running around. Oh, we have one brother, we have one sister, is in trouble. He never knew that this thing was a crime or was an offense and all that. You were trying to help, but at the end of the day, you've been exposed yourself into some legal issue. So we must be very, very careful. We must desist ourselves from such kind of things that can really predispose us and also paint our community red. Thank you very much.
Thank you very much, Mr. Stephen. Mr. Ajibade, your hand is up. Please unmute. Thank you.
Yeah. Good evening, fellow Nigerians. I'm very happy to say hi to everyone that takes time to be on our platform today. Seminar that we just end now, webinar that we just end now. It is really necessary, and that's why need to put it together to make sure that we have this kind of information and this kind of interaction with community. Because the cases of what we have been receiving, attended to for the past few months is alarming. We all can see it. We all can read on social media how many Nigerians were being arrested at Murtala Airport coming to Doha. How many Nigerians who are still in jail now because of drugs issues. You are a picker, you're helping them to pick it and give it to somebody. All these are really, really tarnishing our image. And that's why we raised this, when the government put out the webinar, we decided we need to also patch it across the community so that we can raise more awareness directly. We know many people who are not aware about the webinar, were not available. But like we said, now I can see on the group, we have only 16 or 15 people that are participating, which is very, very discouraging because we tend not to really, really create time for information. And when it happens, the only language we hear is, Nido, you are not sending us information, you're not carrying us along. But whenever Nido is sending us information, invitation for important things like this, let's create our time. Let's even inform others who are not aware about it. Let's spread the information. We have to do it together as a community members, because we cannot do it alone as executive. That's why we're building it up, so that we can open up and everybody can contribute and see how we can really build the community and build the image back as much as possible that we want it to know. So please, we have a lot of cases that has to do with drugs affecting us around here. People are doing cargo. When they're doing this cargo, we have some people who are using that cargo thing of a thing to transform drugs in. And many people have been, I have people who are directly affected by me. I know, close to me. They are not aware that in the cargo that they are part of the team, the joint cargo they're doing, some people have already put some drugs inside it, coming to Doha. And they were only arresting the person who put down the ID card as a consignee until we were able to fight it out. After 6 months, they arrested this person and find out, okay, she was not part of it, she doesn't know anything about it. So please, let us be careful with how we deal with things, how we handle goods, how we'll, whatever we're trying to bring in, do your underground checkup. We have a case of a sister coming in. The husband told her to bring some syringe, some drugs because she was a nurse in Nigeria. She was arrested and taken to the police custody. It took her like 2-3 days to get her back because she wasn't aware about what is happening here. So please, like Honorable Walla said, and our comrade, Mr. Stephen, already given us as part of the discussion, let us please take our time to be conversant and observant of our environment. One name raised by one person is going to affect all of us as Nigeria in this country. So let us put at the back of our mind, whatever steps we're taking, whatever decision we're trying to pull through, whatever we're going to do, please think about us as a community. Don't just think about your own part, your own impact of your own self. Because at the end of the day, they're not going to write it as Mr. Latif. They are going to say a Nigerian. They're going to say a root in Nigerian is coming from Nigeria to our in these days. And with those names being called, it gives the CID, the security service, a kind of negative norms, which makes sure that they cause us to have this kind of subconsciously at the airport. If you all know now, we cannot do a cargo that is more now coming to Nigeria. This was stopped. You can only come with your luggage 23 kilos. If you do more than the necessary cargo, it's going to be it's very suspicious. They will do a lot of things. So please, I'm advising us, let us list to try to go home, to go over whatever they've discussed, presented to us. And I think they are going to provide us with the slides so that the community can also have their time to go over it on their own, at their own spare time. And Mr. Wala can also share the Qatar law so that people can be conversant with them and the drugs that is being avoided, that we can avoid bringing in, and medicine, even the medicine that we're using, like Mr. Stephen said. Some medicine we're using are not accepted. I'll give you a case story. There is this thing that we all know, small doctor in Nigeria. Small doctor was invited to this country some years back by BTN Entertainment. And when he was coming, he had some medicine that he normally used. Those medicines in Nigeria are okay, but in Doha, it is not acceptable. He was put in jail for 2 days until he got a medical report from Nigeria that says that yes, he was supposed to be using that. So this is something we need to be very careful and try to check ourselves about it. And I want to say thank you to Mr. Honorable Piero for putting this together. And Mr. Stephen, thank you so much. And hopefully, in subsequent NIDO event, I hope you're going to be available to also pass across this knowledge to us, the community.
Definitely.
Thank you very much all, and thank you, your community. I appreciate everyone on the group. Thank you so much. And happy Eid to all. Enjoy your holiday.
All right. Thank you very much, Mr. President. Thank you for that wonderful contribution and for your advice. We appreciate you. And thank you for the good work you are doing for Nigerians in Qatar. Mr. Prince, your hand is up. You have a few minutes. You can go ahead, unmute and.
Good evening. Can you hear me, sir?
Yeah, we can hear you. Go ahead.
Okay, good evening. Yeah, I'm sorry, I'm having calls, so that's why the network is ejecting. So I really appreciate for being here on this seminar today, or on this program, which talk about prevention and the substance abuse of drugs, trafficking, and every other thing. So I'm new to this group. I'm very I appreciate it for being here also. And I give my thanks to Mr. Ajibade. So because he's part of the best, part of the people who make the effort for me to be on this platform also. And also my question, I have some question which is not related to what we are discussing. I don't know if I'm permitted to go on to ask.
Go ahead. If it's a private question, you can just message me privately, then we will talk about it.
Okay.
Yeah.
Okay, I think the question goes on like what is going on with Nigerians in Qatar about the QID and other process of this thing. So I think that is the brief, if I can say it here, because it's something that is giving me a concern now. Also, it's giving me concern. So which I need to I need solution to it. Almost like some months. Yeah, almost like a month now.
That's why I said if it's a private issue, you can just message me. I'm the PRO for Nido Qatar. I will take it up from there.
Okay.
Me privately.
Okay, sir.
Okay. Yeah.
Thank you so much.
Yeah.
Okay. Before we round up and wind up the day's activity, I just want to quickly ask a question. First and foremost, this is a beautiful topic we discussed today about drugs abuse and substance control, whatever the case may be. First and foremost, I know this is a global issue. It's not for Qatar alone. And I believe Qatar is a kind of a central where we have most country, especially the Qatar Ahmed International Airport, where we have most country transit from there to different direction. So I think the Qatar law, first and foremost, I know it must be known by those living in Qatar, but most of the passengers who are passing through the Qatar International Airport, we need to know what are the control drugs, that are allowed to passes through the Qatar International Airport, or when you are transiting within the Qatar airport. Because I see it as a situation whereby, okay, maybe in Saudi here, I'm coming to Saudi here, or somebody is going to Bahrain that is going to pass through Saudi, or going to Iraq, going to different country, and we are going to pass through Qatar. And I have drugs that are not controlled drugs within the Qatar health ministry drugs or drugs a substance within their own perimeters. Then now, because I am passing through their own airport, and when they are checking to know what is within my limit, I will be arrested. I don't know how this is managed properly or how they are seeing this. And maybe these drugs are allowed in my country of destination. So how can we, who are passing through Qatar, who are not residing in Qatar, going to manage situation like this?
Okay.
This is my
yeah, thank you very much. These controlled drugs or the list of medications that are not allowed, they are always available with the airline. The airline have this detailed information. So not just Qatar alone, whatever country you are going to or you want to use as transit, the best thing that should be done is contact the airlines, especially if you have a substance that you suspect that it might be not allowed at your transit point. Contact the airline, the carriage of that country. They will let you know the list of controlled drugs for that country. That is the easiest way to get details, so that whatever you have, you can actually check with them. This is what I have. At my destination is allowed, but at this transit point, is this allowed? That is the best way to go about it, so that the person will not make a mistake or fall into trouble.
Let me add more to his question. You know, Mr. Francis, another point you should also understand is that Now, based on the presentation we've given so far, you and I know, we know certain, when we talk about these drugs and substances, we know there are many of them, you and I know, that no country will even allow it in the first place, whether Nigeria transiting through Qatar to Saudi Arabia. When you're talking about narcotics, you know, when you're talking about this marijuana, cocaine, and all this, we know it's out of bound. That one is one. Then two, probably maybe your emphasis might be on the area of medication, those drugs that you take. Now, I will give you an example. It is just that where most of us are coming from, maybe because things are not well regulated, okay? You will take, for instance, like in Qatar and probably in Saudi Arabia, even in Nigeria, there are drugs that are classified as, what do they call it, non-prescription, and there are some that are classified that you must get prescription, even for the fact that you get it in Nigeria without prescription. You should know that a place that things are well regulated, you should be able to get it with prescription. So which means, just like an antibiotics in Qatar, probably in Saudi Arabia, you don't just go to the pharmacy and get it. You need a doctor prescription. Just like Mr. Johnson have said earlier, there is a requirement, even if you must come with such drug, maybe probably you are taking it for treatment, there must be a prescription, a certificate, maybe a document that shows that these drugs were prescribed to you because you were sick, right? And this thing has a validity for like maybe 6 months or thereabout. So there must be evidence that depict that, yes, you have access to these drugs, just like the way Mr. Adibadi have said regarding the small doctors issue. You understand? But unfortunately for him, he wasn't with such certificate or report to prove that he is supposed to be in possession with such kind of drug. I believe at our level, elementarily, we should be able to understand what are those things that should be allowed and those that are not supposed to be also allowed, because those things need prescription. Anything that needs prescription is an offense to take to another man's country, except you're able to verify in their own, with the airline, that this thing is valid for you to be taken across. Thank you very much.
Yes, you are correct. What I was actually referring to is more or less like, for example, now I know in the Middle East, malaria drugs are not controlled drugs in the Middle East, because I think malaria, when you have the malaria, you have to go to your Ministry of Health, series of tests before you can have it be issued to be giving you a medicine for malaria. And now, for example, I'm coming from Nigeria, and I decide, because I've stayed maybe 1 week, 1 month, and within the time of departure, leaving Nigeria, I felt maybe I must have had a contact with mosquito, and I want to have maybe 2 packets of malaria drugs, medicine on my back. So this is what I'm trying to, for me, with, okay, yeah, malaria is, let me use malaria as a basis of my illustration. So, and maybe in Qatar, malaria drugs is now being seen that I must have a doctor prescription before I can take the malaria medicine along, or I will go to jail. So in this case, it's really still a case that because I can't imagine myself to go and meet a doctor to give me prescription before I can take a malaria drugs, because I'm going to my own destination, maybe in Saudi Arabia or in Iraq or whatever the case may be. So this is a kind of what I'm trying to refer to.
Brother, Mr. Francis, see, that is also another mentality that we have developed that is wrong. That is a part of self-medication. You are not yet sick. You understand? You are not yet sick, but you are just because you came in contact with mosquitoes, so you are assuming that in maybe the next 1 week or next 2 weeks that you are going to get sick. You understand? So that is the type of mindset that we have developed in Nigeria that is wrong. So the best thing is, when you are traveling, you are still okay. You travel, go back to your destination. If you fall sick there, you go to hospital, get treatment there. That is to be the right thing to do, instead of trying to worry yourself about taking medications that are not prescribed by a doctor alone, which might not be allowed in your destination country. So that is what I want to add. Mr. Ajibade, go ahead.
Okay.
Yeah, just to kind of stress on what Mr. Francis just said now. please, it's advisable, like Honorable Wala just said, it is advisable as long as you are taking a drug that from your destination to another destination and you don't understand the level of acceptance of that drugs where you're going. The best option for you is to have just doctor prescription. That is the best option. When you have a doctor's prescription, nobody is going to hold you responsible for taking an unacceptable drug to their country. Secondly, it is either you leave it behind or you get a doctor prescription. And for Doha, and please, I'm advising you, please, anyhow it has to be, any drug that you will know that is not acceptable in Doha, and we needed it for our health, let us try as much as possible to get a doctor prescription. When you go to a doctor, you can explain to them why you need the report. So they give it to you, and it can save us a lot of stress, because it's a lot of stress that comes after anyone is arrested with drug issue. So thank you very much.
Okay, thank you.
Thank you very much, sir. I think we've stayed enough on this part. Somebody is joining by now, so we are good to go. So, Mr. Prince, I lowered your hand. You are raising it again. I thought it's old one. Okay, guys, we are good to go. I think there is no more question, so we can call it a day.
Thank you very much. Good night, guys.
Thank you, guys. Thank you for joining today, and thank you for your time. Have a nice day. Mr. Stephen, thank you. Mr. President, thank you.
Thank you very much. Thank you, Mr.
Femi,
President.
you are
Also.
there. Thank you, Mr. Andrew, Mr. James, Pascal, Elias, all that joined on behalf of Nido Qatar. Mr. President is saying thank you, and I appreciate you all also. I will make available the slides from myself and that of Stephen, so you get it from the group. If you're not in the WhatsApp group, you can chat me privately and I'll send to you also. All right.
Good job, Azisha.
Yeah, thank you.
Thank you for having us again tonight.
Thank you, sir.
It's a good topic. Thank you very much.
Thank you, sir.
All right, bro.
All right. See you.
Yeah, cheers.